All right, so we're here at iMedical Equipment at our location, and we're actually sitting in our conference room today, and I'm with two really special people. I'm with Linda and Francis, and Linda and Francis are from Sierra Leone. They've got a nonprofit, a 501c3 that's just been set up. We're going to do a video on that in just a minute, but I think it's important that people understand the motivation that goes behind coming to different places in the States. Now, they're both from Maryland. They're in the what part of Maryland?
In
Bowie, Maryland. And they're trying to open up a center in Sierra Leone. And a lot of this was started because of a personal experience that Francis had with a relative. Francis, if you could, can you explain a little bit about that experience that you had and what happened with that family member?
Yes, thank you so much for giving me the opportunity. I told you this is a story that I don't even want to repeat because it hurt me so much that I was in a very bad condition when this happened to me. When I visited in Africa, Sierra Leone. I was in the city. I had a call from my relative that my sister's daughter is almost dying. She wanted to give birth to a baby. I said, okay, what am I gonna do? They said she's right now sick and congested and shortness of breath and all this medical problems. So I said, you know what? Let me get there. She's all the way in the village. I said, let me get there so we can get her to the hospital. Before I get there, she's already, in the state of very bad shape, actually. So I get to the village with some family members, get her to the car. She died unexpectedly. So we couldn't get her to the hospital. Now, we lose the mother and we lose the baby. In America here, I think it's not gonna happen. So I was looking at myself, I said, I can't help. Where can I help? Because I don't have the opportunity, I don't have the chance, the infrastructure is not there. And I couldn't help because she's dead. We lose the mother, we lose the baby. There is no way to revive. I went there to help, but I couldn't help. And part of it is the village is so remote, and it took me a whole long time to get there. And the lady was in distress, so she died. And I was beating myself. How does it happen? How was I be able to prevent that? I couldn't stop it because the opportunity is not there. I don't have the infrastructure. I don't have, of course, I have the intention to do that, but I couldn't. So I'm thinking about if we're here, we could easily stop it. If we are going to lose the mother, I know we're not going to lose the baby in America. That's the reason why me and my wife were working very hard for us to establish a medical center that can be able to help all these problems.
That's awesome. So what I want to do today is I think it's important that I appreciate, number one, you giving us that story because I know that's very hard to talk about. But I think it's also important that people understand why people do the things that they do to try to make these types of things happen. And you've got hopes and dreams of getting a center built, and our goal is to help you in that process, not just with the medical equipment like we were talking earlier, but helping get funding, helping get support, get people that can rally around you to get this facility built in Sierra Leone. So we're going to do a couple more videos, Francis, before you and Linda take off. But sure. You have a foundation, a 501c3 now that you've set up. What is the web address, Linda?
It's CH Foundation. CHSL, chfsl.org.
Okay, and I'm going to put that up on the
Community Health Foundation.
Yeah.
F.
Okay, Community Health Foundation.
chfsl. org, meaning Community Health Foundation Sierra Leone.
Got it.
.org.
Okay, and I'm going to go ahead and put links to that, and we're going to work on doing some fundraising for you and help push your story out there and also push out this project. We already were able to tie in earlier today with Modesta, who's built an entire hospital from Kenya. She's actually up in Maryland,
And
right?
that is a great success story.
It is.
I hope we are able to achieve
You
something.
will achieve this. So thank you so much for this story. We're going to go ahead and post this online, and then we're going to also put ways to contact you and ways to donate to your foundation. So thank you very much, and we'll go ahead and end it now.
Thank you.
Thank you.